My name is Ahmet Dogan. I'm a hematopathologist based in New York in an academic institution. I work on primarily hematological malignancies or disorders, diagnosis and classification of those disorders.
And how did you first become interested in Castleman disease?
I became interested in Castleman disease during my fellowship, where I worked with the group who first identified the pathological characteristics of HHV-associated Castleman disease. And then I worked at Mayo Clinic for many years, and there was a big interest in that for diagnosis and management of Castleman disease, in particular the associated with Pound syndrome. And that helped me to develop the, if you like, the expertise and insights of the pathological features of Castleman disease.
And then how were you introduced to the CDCN, and what role do you see it going forward for advancing research?
For CDCN, I was introduced with my clinical colleagues at Mayo Clinic, who were invited to be part of the CDCN advisory board, I guess when it was held in 2012 at ASH. And CDCN is the first, I guess, organization dedicated to advance the understanding of Castleman disease with the aim of developing a cure. Previously, all efforts were very fragmented. Because it's a rare disease, the knowledge was very limited. From what we are hoping with the group of people we have been starting collaborating through the CDCN is to develop really standardized diagnostic criteria and a biospecimen bank that would lead to hopefully biological discoveries that could determine how the treatment is going to develop. Without this kind of effort, I think it would be impossible to decipher this disease in a more sophisticated than what we have done so far.
Great. And then what research or maybe specific advancements are you most excited about?
I think I would be most excited about understanding the pathological spectrum of the disease, because we all have limited experiences from our practices and limited to our geographical areas. It appears that there is quite a bit of heterogeneity in the disease, and understanding that spectrum. Secondly, understanding the underlying pathogenesis, what are the reasons for development of Castleman disease. And then, of course, it comes to treatment. That's outside my field, of course, being a pathologist, but hopefully those understanding the pathology and pathogenesis will lead to better treatment.
Great. And then what would you say to patients out there who may be recently diagnosed or are searching for more information? What would you tell them?
I think it would be best to go to the network's website, catch up with the latest science in the area, and find expert advice for management of their disease with the help of the network.
And then for researchers or clinicians out there, what would you say to them who are looking to get more involved?
That they should join the network, share knowledge, clinical histories, pathology, biospecimens, clinical outcomes. That will be the most important thing to do at the moment, because we really need to understand the disease's natural history and developed, use research to identify underlying pathogens and develop better treatments.
Wonderful. Thank you so much.
My pleasure.